Welcome to Aging Insights. I'm Melissa Chalker, Executive Director of the New Jersey Foundation for Aging. The Foundation's mission is to enable seniors to live with independence and dignity in their communities. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. It's time to talk Medicare again. We've covered it before, and we will cover it again. There's no harm in repeating some of the important information while also telling you about new things, like the new Medicare cards. We'll get to that in a few minutes. The good news is you don't have to navigate the Medicare world alone. There is help out there, which is why we will be talking today to two of our favorite Medicare experts, Charles Clarkson from the Senior Medicare Patrol of New Jersey and Mary McGeary of the New Jersey Department of Human Services, Division of Aging Services. So there we go. Thank you both so much for spending your time with us today. I think this is a really highly important topic for us to cover for our viewers. And Charles, I did want to start with you. If you could just, as I said, our favorite Medicare experts, because you've both been with us before, but if Charles, you could remind our audience what Senior Medicare Patrol of New Jersey is and what you do.
Okay, well, it's a federally funded program, and our job really is to educate seniors throughout the state of New Jersey about fighting Medicare fraud, waste, and abuse, because fraud, waste, and abuse costs an estimated $60 billion a year.
That's incredible. And so what are some of the ways, you mentioned fraud, so what are some of the ways that people might, or reasons people should be concerned about fraud? What is Medicare fraud, I guess, is the question.
Well, Medicare fraud is basically people taking advantage of the Medicare claim system and putting in for things they don't really deserve to get, like billing for services never provided, double billing, upcoding. So the beneficiary gets the Medicare summary notice, and that beneficiary should read it. Because if they feel they're being cheated, they can call the Senior Medicare Patrol, and we can help them resolve those kind of issues.
Right. So that's a really important point there. This is one of the things you tell people in order to how to identify fraud is to be making sure that they're looking at that summary notice when it comes, correct? And how often do they get one?
Well, now they get it approximately every 3 months, presuming they go see a provider that's in Medicare. It used to be sent out every month, but that got expensive, so now...
Sure, we're cutting back on mailing and paper stuff, right? So it's important, though, as you said, that people review that when it comes and make sure that the visits on there are visits they really went to or services they really received.
And they should keep a calendar, because you can't remember sometimes everything you did 3 months ago. And then you compare the calendar with the Medicare summary notice, and if you think something looks a little askew, you look into it further.
Right. And you also, as the Senior Medicare Patrol, go out and do education for seniors. So what are some of the other topics that you might educate seniors about in regard to Medicare?
Well, we talk about all the Medicare scams, that Medicare won't call you on the telephone, that you have to be very, very aware of giving out your Medicare number and who you give it to. You only want to give it to people you trust 100%, because that number, and currently it's the Social Security number, is very valuable.
Yeah. Absolutely. So we want to make sure that we're educating seniors. What are some of the most common concerns or questions you get from seniors about those issues?
Well, we get a lot of like who commits the fraud.
I'm
sorry to say that everybody commits the fraud, from doctors to labs to beneficiaries to hospitals. You would think that these big institutions would be a little more aloof from that kind of stuff, but not necessarily.
Not necessarily.
So you have to really be very, very careful no matter what provider you go to.
Sure. Well, I think that's great advice for seniors. And the most important thing for them to know is that if they do suspect fraud or if they have concerns or questions, they can contact the Senior Medicare Patrol.
And we're free.
And ask for help. And it's free.
And we're free.
And you have a phone number and a website and all that stuff that they can get to you and find you.
That's correct.
Yeah.
Actually, we have a new website, Senior Medicare Patrol, NJ.org.
Terrific. That's great. Well, I hope that people go there and find out all of the great things that you do and maybe some presentations they could participate in, as well as asking questions and getting help if they suspect fraud. So we do also have with us today Mary McGeary from the Division of Senior Services, and we wanted to talk with you specifically, Mary, about the SHIP program. And if you could just remind our audience also what SHIP is.
SHIP stands for State Health Insurance Assistance Program. We're also a federally funded program that's administered by our State Division of Aging Services. We're a program that helps provide information and assistance about Medicare to folks enrolled in Medicare or their caregivers. So everything from how to enroll enroll, when to enroll, how Medicare works with other types of insurances you might have, and also once you're enrolled in Medicare, issues with claims and enrollment mistakes and so on. So we help a range of issues.
So now that we know what Senior Medicare Patrol and SHIP do in regard to into Medicare, we should remind people what Medicare is. So, you know, who's eligible, that sort of stuff.
So Medicare is a federal health insurance program. It's been around since 1965, so it's been around over 50 years. And there are three groups of people that it covers: those that are 65 and older, those that are younger and have a permanent disability, collecting Social Security disability, and those with end-stage renal disease. And all the benefits are the same regardless of how you're in the Medicare program. But currently there are close to 60 million people nationwide enrolled in Medicare. So it's a very large program.
Yeah, it sure is. And so there are different parts of Medicare, which could take a long time to explain, but a brief or overview of the basic coverage of those parts.
There are basically four parts to Medicare, and they're labeled A, B, C, and D. Part A is your hospital insurance. Part B is the medical insurance. That covers most of the things you think about when you think of health insurance. Visits to the doctor, medical equipment like wheelchairs and walkers, medical testing like x-rays and MRIs. That's Part B. The other two parts, C and D, are optional parts of Medicare. So Part C is referred to as Medicare Advantage, where you would get your benefits from an insurance company in an HMO type of model. And Part D is the prescription drug component. So SHIP helps folks, you know, navigate those different parts and understand those different parts.
Right. And from the way I understand it, A and B are often referred to as traditional Medicare. Is that correct? And to differentiate it from, as you said, Part C being the Medicare Advantage program.
That's right, yes.
And some of the other things that SHIP does, or some of the other available services, is educate people about Medicare savings programs. Can you tell us what those are?
That's right. There are several Medicare savings programs to help people afford the cost of Medicare, because Medicare is not free. It does have monthly premiums and deductibles and cost sharing for every service that you get. So one of the Medicare savings programs is actually under New Jersey Medicaid, New Jersey Family Care. And that program is called QMB, Qualified Medicare Beneficiary. So those are individuals who earn less than $1,000 a month in their Social Security and their pensions. So that program helps pay all those Medicare cost sharings for them. We also have another program called SLMB, SLMB for short, and that helps individuals pay the Part B premium, which right now is about $134 a month. So individuals with a monthly income from Social Security and pension of around $1,300 a month would qualify for help to pay that Part B premium.
And as you mentioned, all of this is very difficult sometimes to understand or to navigate, and that's why SHIP counselors are there to help folks. So how does someone get in touch with a SHIP counselor?
Okay. Well, we do have an 800 number at the State Office on Aging. That's 800-792-8820. SHIP is available statewide, so we have counselors, over 400 counselors available in all 21 counties, and they're locally based. So you can talk to someone on the phone or meet with someone locally.
Right. And so if you call that 800 number, they'll connect you with someone who's local to you in your area.
That's right.
And if you, as you said, don't want to talk over the phone, you can make an appointment and go in and meet with someone?
That's correct.
Face-to-face?
That's right. We have counseling sites like at the local senior center or the local county office on aging.
So somewhere that's local to people to get to. It's not like they have to come to Trenton. People always call and they say, "Well, this is the the state office. Do I have to go to Trenton?" No. There are local places they can go to meet with a counselor.
Correct. Yes.
Terrific. And as the SHIP counselors, get these calls and make appointments with folks, what are some of the common concerns or questions they get from Medicare recipients?
Right. Well, right now, because baby boomers are turning 65, our biggest question is, I'm new to Medicare. Do I need to enroll in Medicare yet? I'm still working. Or I am retiring with retiree health benefits. Do I still need to enroll in Medicare? How will my benefits work with Medicare? So we help individuals understand the whole enrollment process and particularly what their options are. Because as you said, there's traditional Medicare and Medicare Advantage. There's Medicare supplement policies. So we walk individuals through all of their options on that and give them the information so they can make an informed choice.
Yeah. As I said, it is great to know that there are professionals and services out there that help people navigate this system, whether it be the Senior Medicare Patrol or the services through SHIP with the state. It's good to know that if people have questions or they don't really understand, that they can get help with those things. But one of the things that you're both here specifically for today is kind of our main event, is talking about these new Medicare cards, because this is something that all Medicare advocates are trying to make sure, and Medicare themselves as the government is trying to get the word out about making sure people understand what's happening with Medicare cards. So Mary, if you could start and let us know, well, the first thing I was going to ask is what the new Medicare card looks like, but we have an example here and one that will appear on the screen as well. So could you just explain the basic differences here that we're going to see with the new card?
Right. So the new card is still red, white, and blue, which we're very happy about because we often tell folks refer to your red, white, and blue card.
That's great.
But the main difference is you'll have a new Medicare number. So not only a new card, but now your Medicare number is changing. As Charles said, it's no longer based on the person's Social Security number or the worker's Social Security number. So it's going to be a mix of letters and numbers, and that's to protect the persons from identity theft and fraud.
Right.
They have taken off the signature line and the gender from the Medicare card as well. Again, another way to protect the person's identity. Your name will still be on it, and the effective date of your Part A and Part B will still be on it.
Right. And I think that's important for people to know that the reason behind this new Medicare card is primarily to protect against fraud and abuse and identity theft, because that's why they're taking the Social Security number off and changing the way the card looks in that way, correct?
Correct,
okay.
Yes.
I think it's important for people to know the why of it as well as the being aware that it's going to happen. So we have the example here. What is the timing look? Do we know what the timing looks like in terms of people getting them here in New Jersey specifically?
Yes. Yep. So because there are 60 million people that need to get a new Medicare card, Medicare is mailing them out, so they will come out by the U.S. mail, and they're mailing them out in what they're calling waves by states. So New Jersey is set to be in Wave 4, and Wave 4 is scheduled to be later this summer. So end of July, August is when New Jersey is expected the mailing to be. So because of that, because it's coming in the mail, individuals need to make sure that Medicare has their correct mailing address on file, so that they make sure that they get the card when the mailing happens.
So aside from making sure that they know that their address is up to date with Medicare, is there anything else people need to do in order to get their card? Or I guess more specifically, with the mailing and all of that, if people are concerned about when they're going to get it, is there a way for them to check the status of the card?
There is. So if you're computer savvy, you can register on mymedicare.gov, and you could register your account, and you'll get an email when the cards are going to be mailed out. You can also call 1-800-MEDICARE to see if when New Jersey mailing has actually happened and if your new number has been issued yet. So either by calling Medicare or registering on the website, you can check to see what your new number is and when your new number will be expected in the mail.
Wonderful. That's all super helpful information for our viewing audience. Now, you mentioned when we were talking about SHIP, Medicare Advantage plans, and people also have their Social Security cards. Will this affect any other cards or services or programs that people have?
It will not, and it's very important for people to understand. Even though their new Medicare number is replacing the number that was based on the Social Security, the Social Security number is not changing.
Okay.
So hold on to your Social Security card. That number you still use for the other things like tax returns and bank accounts. So it's important for people to hold on to Social Security card and still use that number when you ask for Social Security. If they and other types of insurances they have, like a Medicare Advantage plan, a Part D drug plan, retiree health plan, and so on, those cards will not change because those are unique numbers for those policies. So it's just the Medicare card. They will bring it with them to their doctor's office when they go to the next appointment. They'll start seeing this new number on the Medicare summary notices and any other claims that they get from their other insurances that they'll have.
So it is important for people to note that when they receive it, the next time they go to see their doctor or other providers, they should bring their new card just so their doctor can have it on file.
That's correct.
As well,
Yes.
right?
Yes.
Terrific. So back to our friend Charles, because he is our fraud expert, and we know that there are a lot of concerns around the new card in terms of possible fraud. So the first thing that I know that you love to address is that when I asked Mary if there's anything people need to do to get their new card, the most important thing to know is that there is no fee, correct?
That's correct.
Okay.
The cards will be free, and they'll be mailed to your address, as Mary said, so make sure your address is correct. And they don't have to do anything. All they have to do is sit back and be patient. And one of the things they should be aware of is that they may not get it at the same time as their next-door neighbor. Even if they're in a senior residence, the people in that same building might all get it at different times.
Right.
But, be patient. It'll come. And technically, we have until April of 2019 to mail out all the cards.
Okay.
So, but, we're in Wave 4. But, we know there are always problems. cards should be mailed to someone of the same name and a different address, so you have to just be patient. And, if you have any doubts, as Mary said, call up Social Security, see if your card was mailed to you, and if it was and you didn't get it, well, they could always send you a new card.
That's all great information, and I think your advice to be patient is hopefully well received. But the other thing, specifically with the no fee, the reason we're telling people that is because there have already been scams that have emerged where people are either calling or getting or sending emails saying your new card is coming, please fill out this form and send in this fee or something similar. Is that correct?
Right. Okay, so we must remember that Medicare doesn't call people. So if you get a call from someone about the new Medicare card, you're pretty well aware that it's a scam. If you get emails and you didn't set up for the email alerts, you pretty know it's a scam. So we want to make sure that people do not fall for these scams. And the biggest thing we've seen is that people are asking for their checking account information to pay for the new card. And of course, if you give that information out, and we have heard stories about it being given out, the money in your checking account is probably not going to be there very, very long.
Right.
So you have to be very, very careful. Right. And, we want people to tell their friends, tell their neighbors that this is coming. Because even though we have made all this effort, some people don't go on the internet, they don't listen to the news. Sure. And we do expect a campaign. We do expect a radio and TV campaign. I just saw some of my doctor's office about the new Medicare card. So we will expect people to be inundated, and hopefully that will take care of the problem. But every time there's a big change in Medicare, and this is a big change in Medicare,
it sure is.
the fraudsters come out of the network.
And the thing we know about this, you said hopefully people won't be victim to these things, but the thing that we know about this is that these scam artists get better and better as each new thing comes out, and they have new tools at their disposal to try to take advantage of folks. So I think it's really important that you say, in addition to people who might be watching, that, if you've seen this, then tell a friend about it. Absolutely. Or tell your neighbor, tell your, tell whoever
and we've already heard stories that people fraudsters are trying to get in touch with people now before the new card comes out, so they can get the Social Security number. And even after the cards are being mailed out, we've heard in some states that people are getting calls afterwards saying, "Oh, you need to pay a fee to activate the card you've already gotten." Yeah. So I'm sure there's going to be a lot more scams. Right. They're always ahead of us, I hate to say it.
Unfortunately, they are, right?
Yeah.
But I think some of the things you've said that are really important for people to remember is that typically Medicare will not call you, right?
Correct.
So the federal government is not going to call your house and say you owe it, or your cell phone for that fact. And that any email communication you get, we recently had someone on talking about cybersecurity and how to protect yourself. So I think it's important for people to know if they're getting an email that says it's from Medicare to really closely scrutinize any links that are in it and the address it's coming from for misspellings and things. And Mary was mentioning you should go, look at Medicare to check the status or to register your account, that you should be very careful to go to Medicare.gov specifically. And those things are very important so that you can avoid falling into a trap of a scam artist.
Unfortunately, in this day and age with the internet, you have to really be doubly careful about your personal information because once it's out there, it could be all over the world. Right. And, I know that it's difficult to do that, but at least take some steps to protect yourself.
Yeah, and certainly we don't want to frighten people and make them scared to do anything or to go out there and into the world with their new Medicare card. But this is just advice and protections to make sure that.
Another thing, it's even though you might hear from Medicare that they should carry their new Medicare card with them, I would suggest they don't carry their card with them because carrying that card doesn't give you any ID. And you don't really need to carry it. If in an emergency, you will get treated. You could always give them that information later. And yet, when I go to presentations and I ask everybody to raise their hand if they're carrying the Medicare card, they all raise their hand. Yeah. And I yell at them, but they don't listen.
They don't listen to you,
Charles. They don't listen to me.
Don't. Oh, that's a shame. But it may be a good idea for people to keep it in a safe place at home and only carry it when they
something,
need it.
Make a copy of it, cross off the letters or the new numbers you're getting, and keep the copy. And by the way, the new card is going to be a piece of paper, smaller than the current card. Really? So that it'll be made to fit into one of those sleeves in your wallet.
Oh, I see.
And people say, why isn't it plastic? Well, it's probably very expensive to make 60
and they're making 60 million.
So people are very disappointed when I tell them that. I said, well, I'm not in charge.
You're not?
No, I'm not. So
If only, right?
Right.
What, if anything else, Charles, do you think people need to know about the new Medicare card and other possible scams? We've talked about the fee, but are there other possible scams?
Yeah, well, don't keep stuff in your mailbox for too long.
Oh, that's a good advice.
If you know that your card is being mailed to you at a certain day, look out for it. Now, if you're an inside resident, you probably don't have to worry too much. But if you own a private home and they say, you know how easy it is to drive by, stop at a mailbox, put your hand in there every day and take mail. And you probably are not going to say anything for another week maybe. And someone has all that personal information. So that's one of the things we always tell people to do. And when you destroy the old card, don't just rip it in half, shred it. Okay, make sure no one else can read it, because that number still has, that old card will still have your social security number on it, your signature, your gender. So you want to make sure you destroy it completely.
Right. That's really good advice, because I was going to also ask you, what should they do with their old card? Should they keep it for records? But you should shred it. You should shred it, get rid of it, don't keep it as evidence.
That's correct.
There's no one's ever going to ask you for it again as proof.
And by the way, the new number, for those who are technically savvy, is called a Medicare Beneficiary Identifier.
Oh, okay. It's not your Medicare number?
An MBI. Well, it's going to be called, I think, the Medicare number in the future, but in case people see MBI or Medicare Benefit Identifier, they should know that's the new number. And as Mary said, only the card is changing, not the benefits. So they should be aware of that.
I appreciate you mentioning the MBI, because sometimes we see these acronyms or other names and people don't know what they are. So it would be good to know if they get something in the mail and it says MBI and they go, I don't know what that is. Do I have that? And you do. It's just your Medicare number, right?
Right.
That's very good advice. So I think all of this is really helpful for our viewing audience in terms of expecting their new card and what else should change. I know, Mary already mentioned that, in addition to the new Medicare number, that they're taking off the signature line and the gender, and you mentioned that that's really for fraud protection and preventing people from stealing
information. Because if you lost your Medicare card or someone was copying it, I mean, look at all that information they had on one little piece of paper.
That's right.
Yeah,
and because not only are we worried about Medicare fraud, we're worried about personal identity theft. You can go with someone's social security number, buy a car, open a checking account, have their name, have their address. The bank doesn't know who you are. Who knows what you can do with that number.
Yeah, and it's just one more reason why, in addition to Medicare fraud, people should be looking out and protecting their personal information at all times. And you wrote a great article for our blog and for our Renaissance magazine that really told people, regardless of what someone's calling you for, if you suspect it's fraud, just hang up. Right?
Just hang up the phone.
That's the best advice.
Actually, one of the things we're saying now is, if you pick up a phone and you don't recognize the telephone number, you're letting a stranger into your house. You wouldn't do it if they knocked on a door. Why would you do it through the telephone? So if you have an answering machine, I tell people, let the answering machine answer every call unless you recognize the number.
Right.
And that will protect you greatly.
Yeah. And I know we don't want to give people too much information because we've already explained the basics of Medicare and Medicare fraud and the assistance that's out there in addition to the new cards. But I feel like it's a good reminder always to let people know that Medicare open enrollment happens at a particular time during the year. So what are the dates? Because it's the same dates every year. Is that correct?
Right.
That's right. Yeah. So October 15th to December 7th is Medicare's annual open enrollment. And that's the time to change those optional parts of Medicare, whether you want traditional Medicare or Medicare Advantage, whether you want a prescription drug plan. And we always advise people to review their coverage during that time. Even if you're happy with the drug plan or health plan that you have, there are always new plans coming out in the new calendar year. Right. You want to compare to make sure to know how your current plan is going to change for the next year. Many of your prescriptions might no longer be covered by the plan that you're in. So in the SHIP program, we can help people do those comparisons. We have information about the new plans for next year, and we can sit down and make those comparisons. And oftentimes, we save people a lot of money by doing that comparison.
Right. That's terrific. And so whether it's about their new Medicare cards or open enrollment or fraud or just questions about how to enroll or how to choose a plan, folks can always reach out to Medicare.gov, which we already said, and call 1-800-MEDICARE is their number.
That's right.
But they can also use both of your organizations as a resource as well, right?
Correct.
We know they can go to Senior Medicare Patrol of New Jersey.org. Is that the new website, right?
Yeah, it's NJ, not New Jersey.
It's
Senior Medicare Patrol NJ.org.
Perfect.
And it's a great website. I recommend it.
You recommend it? Okay. Well, then we'll hope that all of our viewing audience checks it out, as well as contacts the state. And the hotline again is?
That is 1-800-792-8820 is the New Jersey SHIP Medicare information line.
Sure. And we always encourage people to call their county office on aging. If they were to call there, they would be directed to a SHIP program if they had a question?
That's right. So many of our SHIP programs are in the county office on aging. In some counties, they're in other organizations. But not only can they help you, set up an appointment with a SHIP counselor, the county offices on aging also help screen for those Medicare savings programs, as well as our prescription assistance program. So it's a really good place to go, particularly if you're a caregiver and helping someone else. There may be many programs and services available to help you as a caregiver that you're not aware of.
Yeah. I think that's all really great information, and it's good to know that there's more than one place people can look for help and answers to these sometimes difficult things that they have to decide and choose and understand, right? Yes. So I really appreciate both of you spending time with us today. I know that you're very busy going out educating people about these things, so I think it's going to be extremely helpful for our audience to have seen this information here. So thank you again for joining us. And thank all of you for sharing your time with us today. Aging Insights is produced by the New Jersey Foundation for Aging and is made possible by donations to the foundation. To become a sponsor for Aging Insights programs, please go to our website at www.njfoundationforaging.org or call us in the office at 609-421-0206. Our previous episodes may be viewed on our website. We'd like to remind you to find out about senior services in your area. You can contact your county office on aging. Their numbers are on our website as well, or you can call the state hotline at 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.